Just a short while ago, the Health Minister, Dr. Zweli Mkhize, announced the number of COVID-19 cases in the country has risen to 709. That's an increase from yesterday's 554. We understand 2 patients are currently in ICU in private hospitals. Well, Dr. Mkhize joins us now in the studio. Kabazela, good morning. Thank you very much for your time.
Good morning.
You have a very busy schedule crisscrossing the country as you lead the whole National Coronavirus Command Council's efforts on the ground and everywhere. I need to start here first, from a human perspective. How are you doing?
I'm fine, thank you very much. And may we just extend our condolences to the Mutua family. We've just heard the news. So just to say, we really are with them in spirit, and may his soul rest in peace. Otherwise, personally, I'm fine. We are working as a team. The president is strong, the ministers are strong, the officials and the command council is strong. All of us are very strong, and we are really prepared to face on this.
709 COVID cases now confirmed this morning, as you've already announced to the country. When you saw that number, what's top of mind for you?
Well, I believe that it's important to send a message to South Africans that this disease, this infection, will not be defeated by the president, by the ministers, by government, by the doctors, by the professionals. It will be defeated by individuals, the community. Each and every one of us must take responsibility for our own health, and each and every one of us must take responsibility for our community health.
Now, on that point, before we delve deeper into the numbers and how the spread is in the country, community support, are you seeing it in pockets? Are you seeing it across the country? What's the feedback your team is giving you on the ground?
The feedback I'm getting is that there's a lot of support. I get lots of direct messages. My colleagues are getting lots of messages. The president is getting lots of support and messages. And everyone is saying that we're concerned, and they're saying, but we are happy with the steps that have been taken, and they are actually prepared to do their bit to fight the infection, but they're also asking for more and more questions. You get it from the question they ask, you get it from the messages that they send. We really are uniting around this fight, and I believe it's one of the things that we must really use to bring South Africa together, unite ourselves, and we send a message of Ubuntu that the health of the nation depends on each and every one of us. Each one of us has to contribute to making sure that South Africans can defeat the COVID-19.
Basically, it doesn't matter who you are, where you're coming from, do your part to defeat COVID-19.
Everyone has got a role to play. One person can be the weakest link of the chain. And this is where community, solidarity, working together makes a lot of difference. And you've seen that the political parties have come on board. They've actually been wonderful. They've been one message. The churches, the traditional leaders, the sports fraternity, the arts and music groups, everyone has been out there with one message. That is what we need our people to know. There's a major battle that we're fighting. We're on a combat zone, but we must all know, each and every one of us is a soldier. Fight to make sure that you prevent the infection to come to you and also not to your nearest family members.
Each and every one of us is a soldier, but the SANDF soldiers, the real soldiers, will be hitting our streets tomorrow at midnight to support the South African Police Service. Ahead of that, what would your request be to South Africans?
Well, the first issue is that we have asked for people to stay at home. That is the best way of solving the problem. Stay at home. We're also discouraging people from large traveling from one province to the other in large numbers. We've actually asked the churches to stop the Good Friday services, and they've offered to do so. Because of that, there's no other reason why people should be moving all over. We want people to stay put, and the approach is that if you stay put, you're basically saying we're reducing the risk of someone spreading infection to you and you spreading to them. So those who will have the infection will be managing them, and those who don't have the infection must stay away from the infection.
So stay at home is the best advice, unless there's some essential service you need to attend to, or grocery buying. Now, what about jogging? I mean, what about walking a dog? I mean, people live in suburbs. What about going out and running and exercising in the streets after midnight tomorrow? What would your advice be?
You can do that, but what we are avoiding, you can walk or take a walk. You can, walk with your dog. You can jog, but do it alone or do it with, good distance between you, so that you don't really create a sense of infection that can spread. That people can do those things, but we really are saying that it's the mixing of large numbers of people, that's a problem.
And we're still at 100. That's the regulation at the moment.
That's correct.
Not more than 100.
Not more than 100. We might actually at some point maybe consider if we need to reduce, but we want to discourage people. You can't be sitting in a house and all of you are 100 in a house and you're just sitting and there's nothing else that's happening. If it's a funeral or a wedding, we understand that, but people must take the necessary precautions there. Where it's possible, they must defer some of these things, but where it's impossible, like funerals, then there are certain restrictions that they must observe.
Okay, so jogging, running, walking when you're alone or with a partner, but with that requisite distance between yourself, that physical, social distancing is doable. What about public transport from midnight tomorrow? I've seen some questions from various people to say, will there be taxis on Friday morning? Will there be buses? Will there be flights? Will there be planes? What's the message there?
The message is likely that public transport will grind to a halt. However, there will be exceptions made for people who are involved in essential services, particularly those on health, safety and security, mainly those who are doing social services that people need and they can't live without. And then the area of food and some of the essentials is going to be important. So people can still take their transport to collect the food and come back. But what we are discouraging is people going to go throw parties, going to go do bashes and going to do, huge drinking groups where they sit together, smoking and drinking and coughing and all of that.
And there the police and the soldiers will act.
Yes, we would like to discourage that. And for a start, we'd like South Africans to take responsibility for their own health. And we want them to take responsibility. It's virtually difficult to police people. We want to, to plead to them to say it's in their own interest to behave that way. Of course, police will have to come in where their people are breaking the law.
So take responsibility as an individual and do your part.
Exactly. As community, as family, everyone must take responsibility.
Okay. The World Health Organization just 2 days ago announced the fact that health workers in other countries are now being increasingly exposed at risk. You yourself has announced that we have 3 doctors in our country who are exposed. Do you think you're going to be managing to do enough to protect them and give them the necessary resources?
At the moment, we will give them the necessary resources, protective clothes, training, and making sure that we give them support. There are a few other things I won't announce yet, but we will be giving them support. But the 3 health workers are 2 doctors. Both the doctors had a history of travel and were quite sure that they didn't get exposed to their own patients. They got the infection from somewhere else. And then the other one is a health worker who has since established a history of contact with someone who had been traveling in a cruise. So those were quite comfortable. It will happen, but we really know that our doctors and nurses are professionals. They know how to prevent infection. So we'll be helping them to support them with protective clothing.
Besides moving with speed and testing more people, one of the issues is when there's been an identified case. You've stressed this yourself. The World Health Organization has made the same point that you need to then trace whoever else they were in contact with. There's a case of a church in the Free State. You've mentioned it each time you've addressed the nation recently about that church. What's the latest status there? What can you tell our viewers?
Well, we have a number of people who have been contacts. The number is going to a couple of hundreds now that have been identified and tested. We have therefore been able to find out. In fact, I think the number in Free State has increased by 15, and we believe that those are largely associated with the church. And so we want to make a very clear plea to the public that when we said they must reduce the size of gatherings, when we said that we're cancelling some of the big church arrangements and so on, we wanted to actually prevent precisely what has happened. Now, this happened before we made the announcement. So we want to say to people, it is real. You can actually get an infection from few people that can spread to many people. But those who have been associated with the church need to actually contact the Department of Health in the Free State so that they can be assessed. We're now going to move from those who are in the church to those who are associated with those who are in the church. In other words, we've had the people who were infected, then we've now looked at the contacts. Once the contacts are positive, we're now going to those who are associated who may not have been in the church.
Now, that group that you've identified in this particular church in the Free State, are they now in self-isolation or in quarantine of sorts?
Those who have been identified, by the time they get tested, they're actually put on quarantine.
Now, the number countrywide is now beyond 700.
It's 709.
709. Are you going to continue to update us every day to say where are we? And you said yesterday in Pretoria at that start of the economic cluster briefing that you expect the number just to be increasing even during the lockdown.
The numbers will increase, and I think we must be upfront about it. The number will increase for various reasons. One, the numbers of people who are exposed, until we can get all the contacts to be found, there's a possibility of spreading the infection. Until we find all those who have a history of traveling abroad, whether they are visiting South Africa or whether they are returning South Africans, until they are actually put on quarantine, the risk of infection will increase. So we're actually talking to the hotels, we're talking to the airlines that we must actually reduce the numbers of people who are coming in so that we can at least say that there's no risk of anyone getting infected at that level. Then we deal with those who are contacts, and if we can find them all, that means there's no one else who's going to spread the infection. Now the problem is those who could have got the infection but don't know it and they only got it internally. That's why we're now saying lockdown, let everybody stop moving so that even if the infection is there, we can find out within the next 3 weeks and treat you, and then or alternatively, the infection will actually start burning itself out within the days.
Okay. Finally, Minister, as the cases increase, people will wonder, should I go and test? Because I don't know if I've been in touch with anybody. We hear that you might be having the COVID-19 virus in you. You might not show any symptoms. Therefore, you don't know that you are actually passing it around. Should we be testing more? Will the government enable us to test more?
We will increase the testing, but we don't just test anyone who wants to be tested. We test those that have got a history of symptoms and those who have got a history of symptoms, history of contact, history of travel, or you have been asked to show yourself up because your name has appeared in the list of contacts. Those are the ones we're focusing on. We'll change the criteria as right now our Ministerial Advisory Committee is looking at it so that we can look at areas which are targeted. So, for example, if one person was in an area and was found to be a contact, we might then want to go into that area to check how much the spread has gone. But we would like to guide it with a clinical assessment by medical personnel first before we can do the testing.
So there has to be a very valid reason for you to be tested.
Yes.
Thank you very much, Kabazela. That's the Health Minister, Dr. Zweli Mkhize, here with us on ENCA, as he just announced a short while ago that we're now sitting at 709 confirmed COVID-19 cases. The lockdown is coming up tomorrow. His plea, the government's plea, is let's respect it and stay at home.